Why does Ozempic cost up to 400% more in the US than other countries? The answer is greed. Even when it comes to life-saving drugs. Here's how much more Ozempic costs in the US compared to other countries. Ozempic and similar GLP-1 drugs can cost as much as 4 times more in the US than they do in other countries. The list prices for Ozempic, Wegovy, and other drugs prescribed for weight loss are much higher in the US than in similar countries. Few people with insurance coverage of a drug pay the list price, but out-of-pocket costs vary. A bill introduced to Congress would provide Medicare coverage of anti-obesity drugs, which may spur private insurers to follow suit. Anti-obesity drug Wegovy and diabetes drug Ozempic, both of which have skyrocketed in popularity for their ability to aid with weight loss, are priced much higher in the US than in other, large high-income countries, according to an analysis released in August. In its report, health policy organization KFEF found that the average list price for these and similar drugs in the US is roughly $1,000 per month, several times higher than in other countries. This comes as rising costs are driving some insurers and employers to halt coverage of these treatments, called GLP-1 agonists, which are generally taken for a long time. Cost of Ozempic and similar drugs in the US compared to other countries. KFEF used website searches to compare list prices for 4 weekly shots or a 30-day supply of anti-obesity medications. Prices in other currencies were converted to US dollars. A month-long supply of Novo Nordisk's diabetes drug Ozempic has an average list price of $936 in the US, reports KFEF. This is more than 5 times higher than the next highest list price, $169 in Japan. Other countries have even lower list prices for Ozempic, $93 in the UK, $87 in Australia, and $83 in France. In the US, Ozempic is approved for treatment of type 2 diabetes, but some doctors prescribe it off-label for obesity. Novo Nordisk's Wegovy, which uses the same active ingredient semaglutide, has an average US list price of $1,349, more than 4 times higher than Germany's $328 list price. Similar differences in list prices were seen with Eli Lilly's diabetes drug Mounjaro, which is prescribed off-label for weight loss, and Novo Nordisk's oral diabetes treatment Rybelsus. Why do anti-obesity drugs cost more in the United States? The governments of some countries negotiate directly with pharmaceutical companies to set lower prices for medications, but the US does not, which contributes to the large differences in list prices. In a recent development, Medicare now has the ability to negotiate drug prices directly with drug makers, part of the Inflation Reduction Act signed into law last year. The Biden administration announced on August 29 the names of the first 10 drugs subject to Medicare price negotiations. None were treatments for obesity, which are currently not covered by the program. Americans may not pay list price for prescription medications. It's not unusual for drug list prices to be significantly higher in the US than in other countries. This applies to a wide range of medications. However, it's uncommon for most people to pay the list price in the US. Manufacturer rebates and patient coupons may lower the out-of-pocket costs for patients. For example, people with private insurance that covers Wegovy can save up to $225 per 28-day supply for up to 1 year through patient coupons. If their plan doesn't cover Wegovy, they can save $500 per 28-day supply. Pharmaceutical companies also provide rebates to pharmacy benefit managers called PBMs and other intermediaries in the drug distribution system. However, recent trends show that these rebates have been increasing, which has driven up list prices. On average, for each $1 increase in rebates, the list price increases by $1.17, according to research from the USC Schaefer Center. As a result, manufacturer rebates may not lead to lower out-of-pocket costs for consumers. Medicare coverage of GLP-1 weight loss drugs. Currently, Medicare does not cover anti-obesity drugs. But the Bipartisan Treat and Reduce Obesity Act introduced in Congress this year would expand Medicare Part D to provide coverage of approved medications for the treatment of obesity. If this bill is signed into law, It could open up access to these drugs, not just for Medicare enrollees but also for people with other types of health insurance. A lot of people believe that if Medicare starts to cover these drugs, so will more of the private insurers. In addition, as you get more uptake of these drugs, the competition in the space will increase, she said. And that competition will drive down prices. Right now, access to anti-obesity medications in the U.S. is mainly limited to those who can afford the out-of-pocket costs. Those costs vary, depending on a person's health insurance, availability of patient coupons, and other factors. But for some people, the high costs can deter them from accessing these treatments. An individual who doesn't have health insurance that covers anti-obesity medications, or other obesity treatments, will often pay high out-of-pocket costs. And even if they do have insurance that covers these drugs, the copay on these medications are often higher, so people may end up spending a lot of their own healthcare dollars. With the focus on list prices, the true value for society of treating obesity with these medications is getting lost. Research shows that Medicare coverage of anti-obesity drugs would decrease the rates of related conditions, such as heart disease and diabetes. It would also save the program up to $245 billion in the first 10 years of coverage. Obesity treatments need to be available to people, regardless of their health insurance. At the Stop Obesity Alliance, they advocate for a full, comprehensive benefit to be available to all patients through their health insurance. And that includes nutrition therapy, lifestyle changes, medication, and bariatric surgery. What to do if your insurance doesn't cover anti-obesity medications? People whose insurance doesn't cover Wegovy or other GLP-1s for weight loss have a few options to reduce their out-of-pocket costs. This includes looking for patient coupons, like the one offered for Wegovy, that cover part of the cost of the drug for people with private health insurance. However, even at $500 off per month, a person's out-of-pocket costs will still be significant. Ward has also heard of people who have accessed these drugs at lower prices through compounding pharmacies, which hospitals use to produce specific medicines for patients. Working with a reputable healthcare provider and compounding pharmacy is likely to be safe. But some experts have raised concerns that there are additional risks with less reputable compounding pharmacies or online retailers. Although blockbuster medications such as Wegovy are currently in demand, other effective weight loss treatments are available. A qualified obesity medicine clinician can help people find other medicines or interventions, such as nutrition and exercise, that may work for them.